Now, what are some counseling techniques that can be used when we're working with individuals with substance abuse problems? And again, this is not an exclusive list. This is not an end-all, be-all list of what can or should be used. These are just some examples of techniques that can be used, some counseling techniques. And the first one listed is active listening. And active listening is among the most important tools in counseling, in the counselor's overall counseling repertoire. Active listening may be defined as the ability to accurately restate the content, feeling, and meaning of what a client has just said. It requires that the counselor listens to the words of the statement, to restate it in reflective statements, and then to observe the patient's response to the reflection. And this basically tells the counselor whether or not the reflective statement was accurate in its portrayal of what the client said. And this is different from mere reflection. Okay, this is just, it's not just a summary, but what you're doing when you're actively listening, you not only listen with your ears and put it back in those statements for confirmation, but it also has to do with how the client receives the message from the counselor. Is the counselor sending the message that he or she is actively listening? And this may involve such behaviors on the counselor's part as body positioning and posture. Is there direct eye contact that communicates non-verbally with the client that you are attending to and listening? Active listening must occur in an environment where interruptions are taken out and distractions are taken away. You can't have phone calls coming in while you're actively listening with a client. The other distractions that could really not give the counselor a good impression of what's really being said by the client. So distractions and interruptions have to be avoided as a part of active listening. Another technique that can be used is accurate empathy. And accurate empathy is basically defined as the ability to understand people from their perspective. Basically, the client wants the counselor to understand them and their situation. And accurate empathy communicates this understanding to the client, and it further instills a sense of confidence in the counselor's ability to help the client. Okay. It does not mean feeling that the client is it does not mean feeling what the client is feeling, but it does mean understanding what the client is feeling. Okay. And so it's not to be confused with sympathy. So what we're really talking about with accurate empathy is a clear understanding of what is going on with the client and understanding it from that client's perspective. And a key part of accurate empathy is to be non-judgmental. You're not judging what the client is feeling. You're rather understanding what the client is feeling. Okay. So another counseling technique is that of acceptance. Now, effective counsel requires that the counselor acts non-judgmentally. This is often difficult, and it's very difficult when we're talking about working with a population such as substance abusers, because what we tend to do is we begin to judge that behavior. And by judging that behavior as a counselor or a professional, it really strains the counselor's acceptance of the individual as a person, as a client. So only the counselor can decide if judgmental pronouncements facilitate or hinder the counseling or therapeutic process. As a counselor, basically what you're doing is you're taking some self-inventory to see, am I responding as a professional? You're really asking yourself if your reactions may have a negative impact on that client's behavior and that client's successful outcome. So acceptance here, again, you're not being judgmental. You're not saying this behavior is okay either. Another counseling technique, giving advice. Sometimes a counselor wants to give advice to the client. The danger is that the client may come to rely on the counselor and then blame the counselor if the advice turns out to be ineffective. Also, it prevents clients from making their own decisions. In general, it's best to help the clients reach their own conclusions. Okay. Now, there will be times when basic advice is the appropriate response by the counselor. Okay. Confrontation is another technique. Okay, we mentioned this a little bit earlier about confrontation, and we said again, just to redefine, confrontation really refers to a technique that consists of pointing out the differences and inconsistencies between attitudes, words, behaviors. It's really giving back to the client what they said, and then if the client changes that story, the confrontational part is saying, oh no, but you said this or you said that, now tell me which one is which. So confrontation is the most frequently used intervention tool by substance abuse counselors in particular, who have to deal with the client's denial, the client's manipulation, lies, and treatment resistance coming from the client. And this technique used by counselors is really a natural way to confront these behaviors that's presented by the client. So that's what you're doing. You're confronting the denial, you're confronting the manipulation, the lies, and the treatment resistance. And it's critical to confront with an attitude of care and concern. It's even in your voice and how you announce that confrontation should come across in a way that this is occurring, this confrontation is occurring because it should be facilitated, because there's care and concern about you and what's going on with you and to get you better. And the confrontation should not be communicated in such a way as to shut down the client or to close that client off or to shut down any kind of communication. Confrontation, it must be done with sensitivity and timing and with some awareness of the client's ability to handle the confrontation. Again, we mentioned earlier that with certain populations, it may not be effective. And also, it may not be as effective depending on where the person is in that treatment and recovery process. Education is another form of another counseling technique. And if you think about what do we mean by education, well, it's just what it sounds like. Education through explanation is one technique that is frequently used, and education is the intervention of choice when ignorance is the problem. Now, when we say ignorance is the problem, we're not talking about uneducated people. Ignorance is a problem because people lack information. Okay? And they lack information simply because they do not understand addiction and recovery, and they need some basic education, some basic information and some basic explanations of their behaviors, of their actions, and of processes. And typically in substance abuse programs, this traditionally occurs in some kind of lecture-oriented group format, but education can be a part also of individual sessions as well, working with that individual. So education is the giving of information. And if you think about the different treatment models, and we look at the educational model, it says people engage in certain behaviors, and they continue to engage in these behaviors in part because they lack information, they lack education about what are the negative consequences if they continue to do this. So education is a technique, and education is a technique that is combined with other techniques when we talk about counseling. And it is so crucial that people are given information, not just handed a pamphlet of some kind, but they're given information in terms of, let's talk about what is going on. Maybe it's the physical consequences now of the substance abuse, and when you put this into your body, this is what happens to your body systems, and this is what impacts functioning. So you're now educating people about the consequences of their behavior. Exploration is another counseling technique that is used. And exploration is crucial because what happens sometimes is a rare patient will reveal to the counselor all of, it's rare that you're going to get all of the information that you need from your client. And what will need to happen in order for you to get that information, as a counselor, you're going to have to ask more questions. You're going to have to ask follow-up questions. You're going to have to do a little more digging into detail and make some additional inquiry to get at the area you're trying to get. So this could be a real touchy area when we talk about exploration, because especially in the beginning of the relationship, because you may be the professional, but you're still a stranger to the client, and you're an outsider to the client, and you want all of this information about this client, and the client is going to be hesitant to give you all of this information. And they may give you some. They're going to keep the important information to themselves, and it's the information you need in order to help them. So coming up with questions, what questions need to be asked, what follow-up questions need to be asked, the sensitivity with which you must ask these questions, and what are the appropriate ways to state these questions. Again, that may depend on, there could be an age difference between you and the client. There can be certainly cultural differences, gender differences. There could be things that have happened to that client that was so horrific, and just the client talking about those things again and talking about them with someone who they don't know can recall or bring to the foreground certain issues that that client is not yet prepared to deal with. So exploration is highly important, but it must be handled with high sensitivity because of the nature of the counseling relationship, and also the type of information that may come out. So you must do exploration in order to get all of the information, but you must take care in how you proceed with exploration. Humor is another counseling technique. It's probably a technique that has been downplayed. It's a technique that has been overlooked, but humor, it may have its place, especially when it has a larger purpose of advancing therapeutic goals. It can be tension relieving to use humor. And the thing is, a client discomfort may be settled by the use of humor. But make sure if you do use this technique that the humor is appropriate for the situation and for the client, and that it's not just humor for humor's sake. Often humor can lead to you getting information. It can provide you some insight about the individual. Interpretation is another counseling technique. And sometimes patients need to understand why they do certain things. And interpretation may link two or more unrelated events or behaviors to a common thread. And in this way, clients may develop greater appreciation and understanding of their own behavior. It's not your interpretation of what they're doing, but helping them to see what their behaviors are and how their behaviors can be related. Oftentimes, clients can view their behaviors as isolated incidents, and I did that in that situation because of, they fail to simply sometimes recognize patterns in their behaviors, and those are the things you're helping them to interpret. You're not in telling them what they're doing. You're helping them to understand what they're doing and understand why they're doing it. That's what we mean here by interpretation. Okay, let's continue with some counseling techniques. Another one is paraphrasing. In paraphrasing, the counselor simply restates what the client or the patient had already said. It's helpful with confused or disorganized clients, and paraphrasing conveys the message that the counselor has heard and understood what the client said. And sometimes, whether it's as a student in a class or you're purchasing a product or you're purchasing a service and you're not quite clear on what is being said, and when it's given to you in a different way, when it's restated, it becomes clearer. And that's the same thing we're doing with our clients. We're simply restating it or simplifying how it's stated in order to make it more understandable. So just think of a good way to think of paraphrasing is when you go in and purchase that service, or you go to your physician and they give you a diagnosis and they tell you certain things and you're not quite sure what it is. And so basically you're saying, how about give it to me in layman's terms? And that's what we're doing. We're paraphrasing something. We're making it understandable, we're making it clear, and we're simply breaking down the information to make it more consumer friendly. Questioning is another technique that is used, and questioning can be either open-ended or closed-ended. And open-ended questioning requires some comment, some elaboration, some discussion. It requires a little more than a yes-no, whereas the closed-ended is more the yes-no or that single-word response. As a counseling technique, it's best to avoid the closed-ended questions as much as possible because they limit the conversation and they really limit the counselor-client relationship. So open-ended give you much more information. Open-ended can also lead to follow-up questions. So if possible, when you're using questioning as a counseling technique, it is best to use the open-ended questions. Reassurance is yet another type of counseling technique. And many clients are apprehensive about some aspects of their life, and a simple response that assures them of an ability to handle the issue may be all that is needed. The powerful effects that valued counselors can have a client behavior should be minimized. Now, it's not uncommon for individuals going through recovery, going through treatment, to have self-doubt. This is probably one of the hardest things they've ever done, is to get clean, to get sober. And so there is doubt along the entire way. And yes, some reassurance needs to occur. There is serious doubt at that point of relapse. And that's when reassurance as a counseling technique can be extremely helpful to that client going through recovery. Reflection is another counseling technique. And in this technique, the counselor paraphrases what the client has just said. It allows the client to listen to what he has just said as well. If done properly, reflection conveys to the client that the counselor is listening and understanding. Counselors can reflect either a feeling or a thought. Now, here's an example, okay? The client would say, I've been drinking so long, I don't think I'll ever be able to stop. Here's what the counselor will reflect to the client. You feel like a hopeless drunk. Okay. Now, is that a good example or is that a bad example? Think about that, and if it's a bad example, how would you rephrase that? Here's the example again. The client says, I've been drinking so long, I don't think I'll ever be able to stop. The counselor's reflection, you feel like a hopeless drunk. So what is the counselor reflecting here? Is the counselor reflecting feelings? Is the counselor reflecting thought? Is the counselor giving an accurate reflection of what that client said? Our next example of a counseling technique is self-disclosure. Now, self-disclosure is where the counselor tells something about him or herself, something about his or her background, something about his or her experience, and share that with the client. Now, the thing to remember is that self-disclosure must be appropriate, because if not, it can be counter-therapeutic and it will not facilitate the counseling process. So what the counselor should do is ask him or herself if the disclosure will benefit the client in a positive way. If the disclosure is done to help the client to open up about feelings and to elaborate, that's a good thing. But if that self-disclosure does not, or if that self-disclosure is inappropriate, it may sabotage the counseling relationship, because how can you assist the client when you may have some issues that you need to resolve, or it had such a negative impact on you, and now you're disclosing this to the client, that the client, instead of helping the client, it increases the client's anxieties and self-doubt. So make sure the dialogue is appropriate, make sure the self-disclosure is appropriate, and make sure, and above all, that it does facilitate conversation, it does facilitate opening up from the client, and it does, in essence, help the client. Two more examples listed, that of silence. Sometimes silence is the best response. Silence gives the client the opportunity to think about what just has been said. It allows the client to integrate material, to consolidate feelings, and to react to their own statements. Remember that counselors do not always have to say something to be effective. Sometimes a too immediate response can actually interrupt and interfere with counseling. Okay? Also, the silence, or just non-verbalization, must also, during this process, a counselor must also see what's going on with body language during the silence. Yeah. You can't say one thing with your body language and convey another message with your silence. So there should be some congruence there. And sometimes the client just needs that extra moment to reflect and to even think about what he or she just said, and to almost hear what he or she just said. And that's what the silence as a technique will allow the client to do. The last technique that is listed here as an example is summarizing. Briefly summarizing what the client has said or the issues under discussion sometimes is useful, particularly at the end of a session when the counselor can recap the main content of the session and the main course of action. And this is a very basic technique no matter what population we're working with counseling. And you want to summarize, you want to kind of say, okay, this is what we've done in this session, this is what we've said, and I think this is our next direction, because it gives some closure on that session, but it also sets the tone for the next direction. Okay. Some general treatment categories, and these are again some examples. They are not again an all-inclusive list, but social therapist is a general treatment category, and a social therapy would be Alcoholics Anonymous. And we've discussed some what Alcoholics Anonymous is, and that Alcoholics Anonymous have the 12 steps, that have the 12 traditions. But these are, again, are just the listing of some examples of general treatment categories. So if we want to do a social therapy, we would consider something like a self-help group. If we want to do a rational recovery, this is really an alternative. Rational recovery is really an alternative to self-help or AA. And rational recovery emphasizes personal responsibility and free choice. So, rational recovery really de-emphasizes the disease nature of the disorder. Instead, it emphasizes personal responsibility and free choice in the process. It argues that the real problem is an inner voice that craves abusing substances and that directs your behavior. It teaches what is known as addictive voice recognition technique in a time-limited self-help group discussion format. And what this technique does is teaches the client or teaches patients to be responsive to thoughts and feelings that support continued substance abuse. It argues that recovery is not a process, but an event. And attending to and changing these automatic feelings and thoughts will result in the elimination of addiction in as little as 4 sessions. Okay, so rational recovery, that is something to really think about. Is this, again, keep in mind when we talk about these general treatment categories, we're going to have to look at them. What will work with that person? It's not, well, this is the approach I'd like to use. It's only a good approach if it's going to be effective with the client you're working with. Again, you have to, again, look at it. You say, well, this is not a good technique. It may be for some people out there. So you have to look at the person you're working with. And there are those individuals who can benefit quite significantly from rational recovery. Another general treatment category is that of environmental manipulations. And if you think back to Abraham Maslow, and Maslow, remember, developed the hierarchy of needs. And basically what Maslow was saying is that in order for a person to progress towards personal growth and self-actualization, there are some basic needs that must be taken care of. And it is not until those basic needs are taken care of that the person can move toward any kind of self-actualization. Okay. And when we think about what we mean by environmental manipulation, when we talk about substance abusers, keep in mind they come in with a complexity of issues. Okay, so a common example in the drug abusing community is arranging for a homeless patient to find food and shelter and eventually more stable housing. That's of environmental manipulation, because if the primary focus is on meeting those basic needs, being receptive to treatment, going into treatment is not exactly where that person is right now. So sometimes clients can be motivated by a desire to quit the substance, but the problems of someone close to them can be a distraction from their primary objective. So even if we got the person committed to wanting to go to treatment, but if that person has a significant other, for example, who, well, I can't leave because that person won't have any income, that person won't have any place to go, that person will have these issues to deal with. And unless those problems are addressed, the client is not going to be able to focus enough on themselves, and treatment will be ineffective. So when we think about manipulation, environmental manipulations, they're saying, okay, what else is going on in this person's environment that needs to be addressed? Not just the substance abuse, not just the addictive behavior, but what else is going on? And it could be going on with the person, it could be going on with the significant other in that person's life. But what is it in that environment that needs to be manipulated to help this person get to the point of treatment and helping treatment to be effective? So that's what we mean by environmental manipulation. Another general treatment is that of behavioral therapies. And basically what behavioral therapists strive to do is to change behaviors. And they sometimes seek to change behavior without the full understanding of the cause of the behavior. Behavioral therapies work on some very basic assumptions. And there are 6 basic assumptions that behavioral therapies work on. Okay. First, behavioral therapy believe that all behavior is learned, that we come into this world tabula rasa, an empty blank, an empty slate, a blank slate. We don't know how to do anything, except maybe, I think behaviors yield to that. The only reflective action, reflective behavior that people come into the world with is sucking behavior. But according to the behaviors, all behaviors are learned. So whatever we do, we learn how to do it. Behavior therapies are also predicated on the assumption that behavior is largely determined by contextual environmental factors that reinforce the behavior and strengthen its appearance. A third assumption is that thoughts and feelings are also behavior and subject to the same laws of learning. So if you can learn to do something, you can learn not to do something. A fourth assumption is that the same learning processes responsible for learning and behavior can be used to change behavior. Fifth, to learn a new behavior, the person must practice the behavior in environments in which it will occur. A sixth assumption of behavior therapy is that all people are unique and have individualized reinforcements or aversions. And the final assumption of behavioral therapy is that a behavioral assessment is the first step into changing the behavior. According to this therapy, we need to figure out what's going on, why people act that way, in order to change the behavior. So behavior therapy can be organized into techniques that do 3 basic things. It can be organized to treat antecedent clues of drug behavior. Okay. It can be organized, secondly, to treat the actual drug taking behavior. And thirdly, it can be organized to treat the consequences of the behavior. So according to the behavioral therapy, we can concentrate on the antecedents. What happens before the person engages in the behavior? We can do it based, secondly, on the actual behavior, meaning the substance use, or we can do it thirdly based on the consequences, what happens after the person engages in the substance use. Okay. The next general treatment we have are the medical therapies. And with medical therapies, basically what we're talking about is how can we intervene with an individual to make sure that they're going to stop engaging in the behavior. It's not just behavioral, it's medical, it's physical. So what we do in the medical therapist is we take individuals through a process. We take them through stages in which they get better. And with the medical, we're talking about, first we take you through detoxification. We must get the substance out of your system. Okay? So we're freeing the body, elimination of the substance from the body. In the medical therapist is detox, the first phase. Okay? Then we talk about, after we get you through detoxification, we take you through treatment, and then we get you to the maintenance therapies. And maintenance therapies are the things that occur after treatment. And these maintenance therapies are designed to keep an individual in balance. And this balance consists of not using the substance, keeping you physiologically and psychologically healthy. And this is for both the short term and the long term. And again, these treatments are going to vary depending on the individual needs, depending on the protocol for the treatment. But they all, based on the medical therapist, have a detox first, they have treatment, they have maintenance phase, and then they have antagonistic therapies. And an example of this would be something such as antabuse. And antabuse was used for many years for individuals as a part of the after treatment, as a part of the maintenance process, in which a person was given, if you take antabuse, if you drink alcohol, it's going to make you violently sick. And that feeling would be so awful that you would not want to have to experience that again. But that's what the antabuse would do. Now, there were some ethical issues around doing this again, because sometimes, even though people were clean and sober, had no intention and did not intentionally engage in substance use, or didn't even have a relapse. And I'll give an example of this, is that someone who might be taking antabuse to make sure, well, if I take any alcohol, I know it's going to make me nausea, I'm going to throw up, I really don't want to feel that way. And so they go someplace and they have a slice of rum cake. Okay, and there's real rum in the rum cake. But because they're on antabuse and there's real rum in the rum cake, they get this physiological response to having now consumed the rum cake, which contains alcohol, and the person becomes violently ill, even though they're not knowingly and willfully engaged in any kind of consumption of alcohol. So antagonistic therapists, that's an example of some type of antagonistic therapy that can be used. And again, when we talk about these antagonistic therapies, it's important to remember that the patient or the client must be matched to make sure that these therapies work for them, it meets their needs, and also that we're looking at some of the ethical consideration now with a lot of these treatments are less, because we simply do not use them anymore. Okay. And the thing we have to remember when we talk about recovery, there's certain phases to the whole recovery process. And what we must remember most of all is that recovery from any kind of addiction, whether it's alcohol, whether it's drugs, whether it's gambling, whether it's food, whatever the addiction is, recovery is a process. It's a process of growth and development that involves the whole person. People may vary, and so do recoveries. Still, most people go through this process involving 4 basic phases as they learn to re-experience life without substances. And these 4 phases include and I will give you these, I'll give you these in a minute, but the 4 phases they're not feelings or states of mind, they are major life conditions, okay? So it's not how I feel or what I think. So whether you're going through withdrawals or recovery from alcohol, from drugs, from food, from gambling, from sex, whatever the addiction is, there's a general understanding that people go through these 4 phases in order to re-experience life without the presence of that addiction. Okay. Now, the first phase 1, is called bottoming out. And this is when a person is so exhausted. And during this bottoming out phase, what happens is they've broken all the promises they made to themselves, the promises they made to others, and they feel as if there is no lower to sink. They feel like I've hit bottom. I can't get any lower, and everyone has a different bottom. So people bottom out, and what it means to bottom out is different for each individual, but you know it when you feel it, and it feels terrible. That's what we mean by bottoming out. That's phase 1. Phase 2 in recovery is ambivalence. And this is someplace between the stage when people sit on the fence about recovery. Not quite sure if I want to do this. I think I want to do this. I'm not totally committed yet. And also, another characteristic of this phase of ambivalence is the past seems too painful to return to, and the future seems too uncertain and too challenging to feel confident about going either direction. People also seriously consider the possibility of a substance-free life and may begin to feel it out. You know, they're beginning to say, okay, maybe I'm ready to do this. And this phase is a phase of self-doubt and self-examination. There's a lot of uncertainty going on with individuals in the ambivalence phase of recovery. Phase 3 is a commitment phase. Now people begin to act on their ideas about recovery. The patterns of substance-free living emerge, and gradually things start to go in the right direction. Hard work, healthy risk-taking in doing new things, new supportive relationships, new satisfactions, and new stability in the face of problems all mark this period of major growth. Yeah. People are actually beginning to see positives in their lives, and they're now making the commitment to work to maintain those positive aspects. And phase 4 of recovery is integration. And this phase describes recovering substance abusers in their new lifestyles. What it is really just another name for the universal process of finding one's place in the world. And it continues for a lifetime for very mature people. These are the 4 basic phases of recovery. And we want to conclude this lecture talking a little bit about what a client can do to sabotage their treatment. Because keep in mind, you know, if you go back and you look at these 4 stages we just described, it's a process they must go through. They must move through these stages, and at some point along this continuum, self-doubt either is still there, either it creeps back in, it gets elevated at some point, and they start to really question if this is going to be effective and if they're going to be successful. And some examples of how clients can sabotage treatment: acting different. Here, some clients avoid treatment by arguing that they do not belong with different kinds of other clients that are in their program. Because keep in mind, if it's not a specialized program And it may also be a program that you're going to have people going through who may be alcoholics. You may have people who are drug addicts, and then subcategories of drug addicts because they only abuse certain types of drugs. You may have those who are polysubstance users, and you may have those who are there because they're court ordered because they were engaged in some kind of criminal behavior that was related to the drug addiction. And so, these clients have said to you, well, yeah, I'm ready and I want to go through treatment. But now, they're saying, well, this group, I don't belong here with these people. Older people don't want to be mixed with younger people. Single people don't want to be mixed with married people. You may have people whose lifestyles and histories are so diverse that you feel you don't belong in this group and you're different from them, and the attitude of who's better, which individual is better. I don't want to be in this group because in order to support her drug habit, she worked primarily as a prostitute. So you're saying all these things that, these different kind of clients, I'm not like them. So that's a way a client can sabotage your treatment. Another way a client can sabotage treatment is by defocusing. And here, clients try to focus on everything but the concepts of addiction and recovery. It's not uncommon for clients to try to change direction, try to change the focus, whether it's in group counseling, whether it's in individual counseling, inpatient or outpatient, it doesn't matter. What they really try to do is they try to come up with distractions and using these distractions to really not focus in on their addiction and the treatment process. So the client can be very effective in sabotaging treatment through the process of defocusing. Another way the client can sabotage the process is through false compliance. And with false compliance, clients who have had many programmatic experiences can talk the talk but not walk the walk. And what we simply mean by this is that these individuals have been through multiple treatment programs, they've been through treatment multiple times, they know the script. They know what to say, when to say it. They know the answer you're looking for. They can even interpret what the next step is and what their response should be in that step. And they're very insincere because now, they know more about it than you do as a counselor. And so what they're really doing is they're just telling you what they think you want to hear. And because they've been through it so many times, they're not committed to going through it in the here and now. They just know the script and they're replaying the script. So that's what happens when they come across as if they are complying, as if they're following the guidelines and the rules and everything, but they're really not. They're just playing the script over because they know what it is. Okay. A client can also have the treatment process sabotaged by a rescuer. And this person, and it's usually a family member, who comes in as a savior. And this is, again, a way to highlight the importance of treating the whole unit, of treating the people around the client or the patient and not just the person, because sometimes that rescuer will come in because they're now uncertain about what's going to happen to them and what's going to happen to the family if this person gets better, or this rescuer has been so accustomed to coming in and rescuing this person that they think even in treatment they need to come in and rescue them. So, and sometimes the patient is the one who elicits this kind of response, or elicits this rescuer to come in. So that's another thing you need to be aware of when you're working with substance abusers, is that that rescuer can be just as problematic to the treatment process as the individual who is saying to you, yeah, I want to get better, but you have this other, the significant other, who's saying, well, he's got to do this, he's got to get out, he's got to go do that. So that rescuer must also be one you would have to contend with on an ongoing basis. Another way that clients can sabotage treatment is by the I've got a secret syndrome. And this "I've got a secret" syndrome is where the client attempt to engage the counselor's amusement by hinting that they have some type of troubling event that is hard for them to talk about. So basically what this client is doing is nudging the counselor's curiosity by sticking some little trinket out there to see if the counselor will bite. Yeah. So what they're really trying to do is engage the counselor's voyeuristic fantasies and amusement by hinting about something, and they're wanting to see if the counselor wants to know more about it. Okay. This can also be used as a distractor, and that's basically what the client is trying to do, is to not discuss the matters and stay focused. But the counselor needs to be aware of this and stay on track in the counseling process. Another technique or strategy that the client may use is negotiating. Clients may attempt to change certain aspects of the program's rules or provide justification for not needing to attend the prescribed frequency of program visits. So what the client is really trying to say to the counselor is, well, this is a good program. I really want to do it, but ABC is what's really going to benefit me. I don't think D, E, and maybe F is what I really need as a part of this. So if I can just get this part of the program. So they're in the process of negotiating. They don't want the whole treatment protocol. They don't want the whole program. They want to negotiate. They want sort of the cafeteria menu where they can go in and pick and choose what it is that they want to do and what they want to participate in. And you have to be very careful with this, because basically what is going on is not just that I want to go in and do certain parts of the program, but what they're really doing is they're negotiating to avoid treatment altogether. So negotiating is another technique that the counselor must be aware of how the client can sabotage their own treatment program. Self-pity is another strategy, and here the client assumes the poor me role to convince the counselor that the situation is hopeless and that they cannot change. Much of this comes across from the client as moaning, as whining, and what they're really trying to do is convince the counselor that the situation is just something that they can't do, and no matter what I do, this is beyond my control, that I just can't get better because I just try, and it's just hopeless and it's not going to change. So they're really engaging in the self-pity. And the self-pity is another way of saying, well, I don't have to be committed to this because I already made it clear to the counselor that I can't change. It's not going to get better. And it's just poor me. I've tried so hard to do it. So this is another strategy. The addict game is the last strategy we have listed here as a way that clients can sabotage treatment. And clients play certain games in the treatment process to avoid effective counseling. And for them, the goal is to win, not just to play and participate in these games, but for them to win these games. And if they win these games, that means they can maintain their current behavior. It gives them a sense of authority, it gives them a sense of power in their ability to outwit the counselor. It gives them a certain status within their group as it's okay that this guy is deviant, but isn't he good at it? So there are certain games that addicts will play, and it's a power play. And if they feel they're winning, and even if they come across as if they're winning, then that subgroup within the group will see the deviant as having authority and as having power. And this is something within a group counseling session that counselors really need to be aware of, because it can not just sabotage that particular person's treatment, but it can sabotage the treatment of other individuals within the group. So it's important we think about the overall picture of treatment and the multiple components that go into treatment. It's what happens prior to seeing that person. It's what happens when they go into detox. It's what happens when they get into the actual core of the treatment program. And within that treatment program, is it voluntary? Is it involuntary? Do they stay? Do they go? Are they trying to sabotage you? You have others trying to be rescuers. Are you doing a good job at being an active listener as a counselor? Are you doing a good job at doing reflection? Are you using self-disclosure? Is that self-disclosure really appropriate? And if it is, then what is my next step? If I'm not doing what I need to be doing, how do I get back on track? And the main thing we really want to remember when we talk about treatment is we need to think about treatment as a process. We need to think about recovery as a part of treatment. We need to think about relapse as a part of treatment. We need to think about aftercare as a part of treatment. Treatment is not just a 28-day inpatient treatment program. Treatment for substance abuse is by all means a process. It is a partnership between the counselor, between the substance abuser, between those significant others and those family members that are also impacted by the substance. And if treatment is indeed going to be successful, it must be looked at in a holistic manner.